All the food and dietary supplements that we mention on this program are intended to contribute to the daily diet and overall health. They're not intended for the use in the prevention, treatment, mitigation, or cure of a disease or health-related condition. Individuals who have or suspect that they have an illness or who wish to commence a diet or exercise program should be consulting with an appropriately licensed healthcare practitioner for their medical health history evaluation, diagnosis, treatment, and health recommendations. Welcome to the Health and Wellness Hour with Dr. Joel Wallach and Pharmacist Keith Abell. They believe when it comes to nutrition and supplementation, the modern medical system has failed you, that our body is divinely designed to repair itself given the correct foundation of nutrients. With a combined 85 years experience in health, nutrition, and supplementation, they bring a unique perspective on how to manage disease and improve one's health. Over the next hour, Dr. Wallach and Pharmacist Keith will discuss health and wellness topics seen in the news. They'll discuss trends in nutrition and supplementation and how you can take control of your own health and your future. Let's get on with the show. Good morning, everybody. This is Pharmacist Keith and Dr. Joe Wallach. I want to welcome you to the Campaign for Nutrition, Health and Wellness Hour. How are you this morning, Dr. Wallach?
Well, very fine. Thank you so much, Pharmacist Keith, and happy Father's Day, all that jazz.
Well, thank you. You too.
Thank you. People don't realize it, but when you're born, you're already 9 to 10 months old. When you're born at 9 to 10 months of age, your heart has been beating since you were 21 days old as an embryo. Okay. Your heart will beat 40 to 60 times a day at resting beating rate until the day you die. It might be 50 years, 60 years, 70 years, 80 years, 90 years, 100 years, 150 years, 200 years, whatever it is. That heart never stops beating. Your brain rests when you go to sleep. Your muscles rest when you go to sleep or sit there and do nothing. Your bones aren't making red blood cells every second, of the day, but your heart never stops. And so again, when you're born, you're already 9, 10 months old. So I'd say 3 months into your life after you've been born, you're already a year old. And I give people credit for that. Okay. That should, if your driving license and your gun license and all that kind of stuff, they should add that 9 to 10 months to it because, you worked hard to develop into a healthy, functioning human being. And people forget that 9 to 10 months of development. And of course, I was double checking with the, the cardiology information we have. And the heart starts beating at day 21, day 22 of embryonic life after conception. And so right now, you have to appreciate that we spend, let's see here, for heart disease, $316.8 billion just to treat symptoms of heart disease, just to treat the symptom, not to cure anything, okay, not to reverse the problems, but just to reduce symptoms to comfortable levels, into the normal levels, just reducing symptoms each year in America for heart disease costs us $316.8 billion. I mean, that's crazy when you think about it, because if everybody did everything right, we eliminate that $316.8 billion in expenditure because you wouldn't have congestive heart failure. You wouldn't have hypertrophic cardiomyopathy heart disease. You wouldn't have edema to where you need to get a valve replacement because your heart was dilated and all that kind of stuff. It's all just a simple nutritional deficiency diseases. And one of my newest ones I ran into was dialysis. Everybody knows about dialysis. Well, we spend $24 billion a year in America alone for dialysis. Now, dialysis doesn't solve any problem. It might be useful for a couple of weeks, after kidney surgery or kidney transplant or something like that. But dialysis shouldn't be something you're on for 40, 50, 60, 70 years, okay, because you should be able to support your kidneys so it can do its job without the dialysis thing. We take people that haven't urinated in 10 years and that during the 10 years they were on dialysis 6 days a week. We put them on our program, and in 2 weeks' time they're urinating again, so they drop the dialysis down to 3 days a week. And then in 2 more weeks they're totally off of dialysis after 10 years and not urinating. The kidneys, like all tissues in the body, have an enormous capacity to heal themselves, just given the right raw materials. And, I could go on and on and on. Alzheimer's disease is a scary one because right now we're at 305 billion just to treat symptoms of Alzheimer's disease each year in America. And they're projecting that within a year, it's going to be $1 trillion a year just to treat the symptoms of Alzheimer's disease in America alone. $1 trillion. Well, guess who's going to pay for that? Okay. And so it's one of those things I really urge everybody to get on this and to think about it. Arthritis, we spend $626.8 billion, $626.8 billion each year in America alone just to treat the symptoms of arthritis. Is that crazy? That's crazy when you think about it, because you can rebuild the joints, you can rebuild the tendons and ligaments, you can rebuild the connective tissue, you can rebuild the muscles. And so what happens is if you leave it up to the doctors and the, what they say, their associates, okay, nurses and so on, you're going to be turned into a dairy cow. I don't care what your gender is, you're going to be turned into a dairy cow, and they will milk your insurance policy, okay, to its maximum. And so you really have to pay attention here. This is crazy stuff, and we're here for you. And I can't thank Pharmacist Keith enough to make he has so much to do, his valuable time. And so we really, really appreciate all that he's doing. And of course, we have a big project coming out. We've been doing this for more than 2 years now.
About 3 years, I think.
About
see when our anniversary date is.
Yeah, I think it's 3 years. And you're right.
We started when COVID started.
Okay, yes, it got to be 3 years in. And so it's one of those things where Pharmacist Keith picked 10 of our best programs, and each one, has a lot of stuff in it, but it has a primary subject, okay, and it's like 10 different diseases, and they're 1 hour CDs, and so there's going to be 10 of them in this set. Mm-hmm. In 1 hour CDs. I'm very excited. And how close are we to getting them to the printers?
Probably 3/4 of the way through, Doc. It's
okay,
basically
cool.
10 cassettes. Listen to me. You're showing my age there, Doc. It's basically 10 audios. Each one has a theme for the first half, and then the second half is just Doc Wallach answering questions.
Q&A stuff.
So that's basically how that works. And, Doc, you said a lot of information, a lot of interesting information this morning about all these different diseases and the costs that these diseases are causing our healthcare system. But you didn't touch on one thing, and that was what's causing this? What's causing all these different diseases? It just seems to be getting worse, too.
Yeah, well, they're nutritional deficiencies. And you have to appreciate that plants cannot manufacture minerals. And 2/3 of the 90 essential nutrients are minerals. And that's, again, where wood ashes came in the old days. Grandma would put wood ashes from the kitchen stove into our soup and our stew and our mashed potatoes and on our salads and on our drinks and everything. And we were getting minerals that way. And then Grandma would also put these wood ashes into our gardens. That was one of my jobs as a little kid, 3, 4, 5 years old. I'm taking a bucket of wood ashes out to the garden and putting cupfuls of that up and down the rows, in between the rows of onions and squash and tomatoes and sweet potatoes and see here, cucumbers and so forth. Onions are one of my favorites. And we're putting those wood ashes, which are minerals, but plants can make vitamins, but plants cannot make minerals. So once we went to electricity at 3:00 in the afternoon, Monday, September 4th, 1882. Okay, and so the whole history is in this book called Hell's Kitchen. And we named the book Hell's Kitchen after this district in New York City where everything bad happens. And so they called it Hell's Kitchen. They gave it a name, Hell's Kitchen, because everything in the world bad happened there in that part of the city in New York City. So we named the book after that part of the city, Hell's Kitchen. And it's one of those things where, as you point out, if everybody were to take these essential factors on a regular daily business level, okay, in some cases 2-3 times a day, some issues, we could eliminate 95% of all these degenerative diseases we're spending all this money for just to treat the symptoms. Mm-hmm. They're all nutritional deficient diseases, primarily mineral deficient diseases. Plants can make vitamin C. Plants can make B vitamins. Plants can make vitamin A. Plants can make amino acids, that kind of stuff. Plants can make essential fatty acids. Oh, but can plants make minerals? No. Plants only need 3 minerals, okay, to do a good job of reproducing and doing their job as plants, producing oxygen and so forth. But when it comes to the animals and people who eat those plants, if you want your 60 essential minerals, you're going to have to constantly, proactively put them in your mouth, because you don't know where those plants were grown. You don't know what the minerals were like in the land where those plants were grown, because nutritional minerals do not occur in a uniform blanket around the crust of the earth. They occur in veins like gold and silver. And that's why people, they have this wonderful recipe. They live in the Himalayan mountains, and they have this recipe, and they live to be 160. And so you bring that recipe home and you use that recipe and then you die at 75. And you're saying, God, why did I die at 75? I did the same thing they did in the Himalayan mountains. And God says, well, stupid. In the Himalayan mountains, they have all these glaciers and volcanoes and everything, and they have 75 minerals in their soil. Mm-hmm. You only have 3 minerals in your soil, stupid. Okay. And so
I want to point something else out too. Over the decades, the vitamin content has gone down in these plants as well. And that's because for the plants to make the vitamins, they need certain minerals. And when they're lacking those minerals, they do not produce the vitamins as well as they used to. And it's all because there's really 3 factors. Electricity came along, so we stopped supplementing our soils with all the minerals from the wood. The second issue is we've built all these flood control devices along the rivers to keep land from flooding, and those flood control things are keeping the silt from the mountains thousands of miles upstream from getting down into the farmlands and revitalizing the soil. And then number 3, we produce the heck out of our food, production. We have optimized plants for growth, not for vitamin content. We put all these pesticides on our plants. We process the heck out of them in the manufacturing process. So when you get to the end product, it has nowhere near the nutrient value it had when it started. And those are the 3 things that are causing us with all these nutritional deficiencies. And the modern medical system still, for the most part, is ignoring it. We're starting to see more and more doctors come along with Dr. Wallach and his message there. They may not admit they got the information from Dr. Wallach, but they're starting to see the light and see that there's things that we need to do to change it. We have to start supplementing. So there is thankfully, a group of folks out there, like myself as a pharmacist. These prescription drugs are only meant to do one thing: to manage a disease, to keep a disease from getting worse. They're not meant to reverse the disease. Your diabetic medication is never going to improve your diabetes. It's just going to help you control it a little bit better. Your blood pressure medicine is never going to eliminate your blood pressure problem. It's just going to control it. And that's where the medical system has failed us all these years, is they've made these wonderful drugs that do these things to prolong our life in that way, but they've done nothing to reverse the problems. They've done nothing to educate people that they need to have all 90 essential nutrients for the bodies to do what the body does best, and that's to fix itself. And that's where Dr. Wallach and I come in. Dr. Wallach thankfully enlightened me many years ago with my mother-in-law. She had a quadruple bypass, and she was just suffering from the side effects of all the drugs they had her on. And working with Dr. Wallach, I wasn't even part of his company back at that point, but working with Dr. Wallach, I managed to get my mother-in-law off all those prescription drugs. And she went on to live into her mid-80s before her COPD finally took her with lung cancer. She refused to give up her cigarettes. But other than that, her heart problems, they pretty much went away. She wasn't on any prescription drugs for those heart problems anymore. And she had a strong, healthy heart. And the doctors were always amazed by it, even though they didn't want to know what we did to do it, but they were always amazed by it. So, the whole point of our program every week is to talk about these 90 essential nutrients and what they do for us, and how they can help reverse some of the diseases. Now I got shameless plug I want to play for you real quick. We're getting into the summer and they're predicting extreme heat.
Yeah, I like Rebound. Rebound is so good.
That's the product Dr. Wallach developed for NBA star Theo Ratliff. When Theo Ratliff had a lot of problems, he had some brittle bones and tendon problems, and basically was told he'd never play basketball again. So that Rebound product was designed for Theo Ratliff to help him recover, and he went on to have another 10 or 11 years of basketball playing time after that product. And I so much talk about this every week because it's a product that anybody that's in any kind of occupation where they're doing any type of sweating really needs to have in their arsenal. Instead of the Gatorade or Powerade or whatever other sports drink you have in your coolers, they're only replacing maybe 3 minerals at best. And when you sweat, you're sweating out all 60 of those minerals that Dr. White was talking about. And that's what causes athletes to not live as long as a couch potato. Believe it or not, some of these star athletes, their life expectancy is nowhere near what the life expectancy is of a couch potato that's sitting there eating all those chips, and their activity of the day is having their grandkid go get the remote for them. So, we've got to replenish what we're losing when we're in any type of occupation where we're sweating, we're a sports athlete, etc. And that's where that Rebound drink comes in. It comes in 3 convenient forms. We have it available in the can, as you saw on that commercial. The can is very tasty. I love that. I like to put that in a cooler when I go to the beach. We also have in these individual sticks. This is fantastic. You fill the cooler up with water bottles, and then you just take one of these sticks and put that into your water bottle. Or we have the least expensive way to get it is in a canister. All the same product in all cases. It has all the, it's got 72 different minerals in it. It has all the amino acids, vitamins. It has a little bit of green tea in there and ginseng for energy. It's a fantastic replacement for anyone that is an athlete or out there gardening, whatever, when you're out there sweating.
And you get an A+ pharmacist, Keith, because you know that story as well as me. It's a beautiful story about athletes. Of course, Theo Ratliff, he also had a fracture of his wrist on his shooting arm, and he is one of their best shooters in the Atlanta Hawks. And they took his contract away from him. They said, well, you're a good shooter. You're a good defensive player, but you're too fragile. You can't play. So they took his multi-million-dollar contract away from him. We put this together for him. Pastor Creflo Dollar, from Atlanta, Georgia, introduced me to Theo Ratliff. And we built the Rebound for him. And we also came up with not only the Rebound sports drink, we came up with the bone and joint pack for him. And so that worked very, very nicely. And you have to appreciate professional athletes, according to the FDA, professional athletes live to be 62. Unless you're a high-end basketball player, it's 31. Okay, what's going on here? Well, they sweat, as Pharmacist Keith said, sweating out these nutrients. When we came up with the Rebound, for Theo Ratliff, and we came up with a Healthy Bone and Joint Pack for Theo, he played for 11 more years. I mean, high-end played. He made $100 million during that 11-year period. He made $100 million, okay? And here's a guy whose career was over until he started taking these essential factors. Now, and he did a great job of, running around lecturing to high schools and Boy Scout and Girl Scout troops and all that kind of stuff. And he actually took some of his money and built a facility, I think it's in Alabama, where they have facilities to bring in kids who want to be successful athletes. And he trains them on how to eat, how to take their essential factors correctly, and how to train. And I just really respect him for that, because he didn't have to do that. But I think, giving back to the up and coming next generation, I think was really a blessing on his part that he did for the community, meaning America and the world. And so we do this literally thousands of times. And of course, we did a similar thing for Evander Holyfield, great heavyweight boxer. Make a long story short, he lost his heavyweight championship to Michael Moore when he had a heart attack in the 12th round of his defense of his title. And so by default, Michael Moore won the championship. So we came up with a Healthy Brain and Heart Pack for Evander Holyfield and got him going on that. And a year later, he comes back and he defeats Iron Mike Tyson, who had beat Michael Moore to take away the championship from him. So Evander Holyfield came back and beat Iron Mike Tyson to get his heavyweight championship back. Who comes back from a heart attack to win a heavyweight championship fight in the ring against a tough guy like okay, like Holyfield? Is just amazing. And so it just shows you what proper nutrition can do. And so, and Evander Holyfield is still going strong, okay? He's still held up as one of the greatest boxers ever. Even though he had that heart attack, people forget. He was on our program for a little over a year before he took his championship back from Iron Mike Tyson.
Absolutely. And folks, I encourage you to go over to Dr. Wallach's website, drjwallach.com. That's drjwallach.com. And get the CD, Dead Athletes Don't Lie. That's the CD, Dead Athletes Don't Lie. And share that CD with folks that you know that are in athletics or out there sweating for a living, you know, the roofers, the construction guys, the people working out on the farm. Be sure to share with them that Dead Athletes Don't Lie CD. It's drjwallach.com. And I encourage you to get all your friends that have this type of occupation to, at minimum, at least get them on the Cherrymans or strawberry kiwi mins, so they can get all the minerals in them. Preferably get them in the Rebound, because it's also got all the other vitamins and amino acids that they need when they're in that type of occupation. I encourage you to do that. drjwallach.com. That's Dead Athletes Don't Lie. Dr. Wallach, you want something to add to that?
Yeah, I want to add to that a good way to build an army is through Boy Scouts and Cub Scouts and Girl Scouts and Brownies. Get them on this program and get them handing out those CDs to young, kids their age and kids that are older than them, and grandpa and grandma who are going to the gym to exercise and so forth. And, they get their badges and all that kind of stuff. But I was a Boy Scout. I was an Eagle Scout, an Explorer Scout, and went around the world training people based on what I had learned in scouting. And so I think they were a great asset in helping us win World War I, helping us win World War II, because they were at home saving America while all of our young people were out in the world saving the world. And so you can't forget scouting, Boy Scouts, Girl Scouts, Cub Scouts, Brownies, and get them going here. They'll be able to make enough money, okay, as an associate with us, as a Girl Scout and a Boy Scout, a Brownie and a Cub Scout. By the time they're old enough to have a car, they can buy their own car. Okay, I mean, how good is that?
Okay, and I want to jump over and see if we have any questions. I know we've got a lot more people on today than normal. So if you have any questions for Dr. Wallach, if you're on the Zoom side, go ahead and chime in. Facebook, just put a comment and I'll read your comments. So any questions for Dr. Wallach today?
Chip.
Yes, who is this?
Shabar Knight.
Yes.
Yes, I have a couple of questions for Dr. Wallace. I have cataracts on my eyes, and I suffer from high blood pressure. I have congested heart failure, and I'm coughing up blood. So I'm just wondering, do he do you have any questions for me? What I could do about that?
Okay. How old are you?
66.
Okay. How tall are you and what do you weigh?
I'm 5'5" and I weigh 234.
Okay, at 5'5", I'd like to see you weigh maybe 140 pounds to maybe 80, 90 pounds overweight.
Yes.
Okay. And let's see here. Do you have anything going on in your lungs or your throat?
Well, I'm an asthmatic, and like I was saying, I be coughing up blood, and I've been doing this ever since last year.
Mm-hmm. Okay. Have you been to a doctor about that?
Yes.
And what did they say?
Have. Well, what they're gonna do this test to put this tube down my throat to see where the blood is coming from.
Okay, yeah. Okay, so it's kind of interesting here. Let's see here. Do you have any high blood pressure or diabetes?
No.
But you do have high blood pressure?
Yeah, I have high blood pressure, yes.
But no diabetes?
No diabetes.
Do you have any joint problems, any arthritis, osteoporosis?
I have spinal stenosis.
Okay. Do you have any ringing in your ears?
Sometimes I do.
Okay. Has your voice changed?
No, it's still the same.
Okay. Do you have any trouble swallowing or difficulty in swallowing?
Yes. Sometimes, if I eat food, I can't get it down. I have to drink something to push it down.
Yeah. Okay. All right. What about your bowels? You have constipation, diarrhea, irritable bowel syndrome, celiac disease, Crohn's disease?
Sometimes I had trouble. I'd be constipated. I've had trouble with my bowels.
Okay. Any skin problems? Any eczema, dermatitis, or psoriasis?
No.
Okay. Well, at the very least here, you have osteoporosis of the skull causing the tinnitus, the ringing in the ears. Also, I think it's what's causing, it could be since you have trouble swallowing, it could be causing this bleeding when you cough. Okay. Because when you squeeze the 9th cranial nerve, okay, the glossopharyngeal nerve, your voice changes, you can have difficulty in swallowing, all that kind of stuff. Tinnitus, ringing in the ears. This is a squeezing of the auditory branch of the 8th cranial nerve, okay, causing the ringing in the ears. Do you have any balance problems?
Sometimes, yes. Sometimes I do.
Okay. Okay. That's the vestibular branch of the 8th cranial nerve being squeezed. And then spinal stenosis is self-explanatory. When you get osteoporosis, the bones get thicker, and so they're squeezing the spinal cord, causing things going on downstream. You have numbness and tingling in your legs and pain in your joints, correct?
What you say in my no? Oh, and I also have arthritis in my spine. That's what I meant to say.
Yeah. Okay. Yeah. Arthritis in spine. Okay, that goes along, with the spinal stenosis.
Oh, okay.
So, you need to take one meal a day or keto shake. 1 meal a day or keto shake. It's not a meal. It's not to add to a meal. It's a meal replacer. Okay. You can also have 2 of the rebound drinks at the same time with the keto shake. 1 meal a day doesn't have to be the same meal. Okay. And then for all these other issues, I want you to get rid of all the bad foods. No fried foods, no processed meats, no oils, no glutens, no wheat, no rye oats, no sugar, no carbonated drinks. Even the diet ones got to go. Because the carbonation in the diet drinks neutralizes stomach acid, so you cannot absorb minerals or digest food. Then at 234 pounds, I want you to have 2 of the Healthy Brain and Heart packs per month, a full dose of everything twice a day, full dose of everything twice a day of the Healthy Brain and Heart pack. I also, because of all your joint and bone problems and everything, I want you to have 2 bottles a month of our MSM. So you can take 3 of those at breakfast, 3 at lunch, 3 at dinner time. They will support and promote maintenance repair, cartilage, ligaments, connective tissue, disc between the vertebrae, bone mix, bone itself. The congestive heart failure, I want you to get our de-stress capsules. Go ahead and take 3 of those twice a day. There's 2 bottles a month of the de-stress capsules. For the high blood pressure, I want you to get 2 bottles a month of our Ultimate Daily Classic tablets, and they will support and promote healthy blood pressure and healthy blood flow through blocked arteries. There's the coronary arteries, the brain arteries, the arteries in the kidneys, and so forth. Okay. And then all this stuff, the asthma should go away. Okay. And, but when you get that examination, give us a call, let us know what they find or that they don't find. Okay. And so we'll walk you through this because all of this is due to osteoporosis of the skull, osteoporosis of the body, and doctors forget the skull. When they talk about osteoporosis, they're always talking about the hips and the knees and the vertebrae, but they never talk about osteoporosis of the skull. There's 25 different diseases. We actually have a little book. Okay. It's called It's All in Your Head. Okay. It goes into the 25 different diseases you get when you get osteoporosis of the skull. And the doctors will send you to like 5 or 6 different specialists, okay, for hearing aids, for vision stuff, okay? And the cataract thing could be just the skull squeezing the optic nerve and the optic artery and the optic vein, causing the doctor to think you have cataracts because as that nerve gets squeezed, see, that's where the trouble is coming in. Okay.
Okay. She also did not mention to you, but she takes cholesterol medication. So my question to you would be first, have they told you what your triglyceride levels are? Because your high triglycerides can also add to the cataracts issue. It's the triglycerides is more of a problem than cholesterol. Cholesterol, to me, and Dr. Wallach, is really not the issue. Cholesterol is a sign of a problem.
Yeah, cholesterol is a essential nutrient.
Right.
A large portion of your brain is cholesterol. It's the white matter of the brain. Okay. It's the myelin of the brain, the insulation material of the brain, the spinal cord, and all the peripheral nerves is cholesterol. Going on statin drugs, there was no such thing as Alzheimer's disease until 1960 when they came out with statin drugs to lower cholesterol because they made a mistake and thought the cause of plaque in the arteries was cholesterol. No, it's salad dressings and cooking oils. And fried foods. Okay, they got it all wrong, and then they screwed it. They screwed everything up.
I would like for you to ask your doctor to find out what your triglyceride levels are. Because high triglycerides is more likely to cause heart issues, and even the cataracts.
So cholesterol.
Yeah.
Oh, okay, then.
Okay. We'll look forward to hearing from you in a couple of weeks.
And let me know what the doctors say about the blood coming from your lungs. Hopefully they'll do ultrasound or something as well as not just use a scope. But
okay, then.
Okay.
Thank you.
Cherie, you put something on here about a female age 44. You want to jump on and tell us about that?
Okay, hold on.
Yeah, Cherie.
Okay. Oh, sorry. Can you hear me?
Yes.
Gotcha.
That's my sister Siobhan from Chicago. Thank you so much for being on the call. Yes, I have a female age 44. She's 155 pounds. She's 5'7". She's not a diabetic, but she does have high blood pressure. She said she's on the 90 and she's seeing pretty good results. Her chief complaint, Dr. Wallach and Pharmacist Keith, is that for the last 2 months, she's having a lot of pain when she's moving her bowels, and she's seeing bright red blood in her stools. And I told her that I would get on the call and see if we could have some recommendations for her.
Yeah, I would first recommend that she get a Cologuard test because she wants to eliminate the possibility of some type of bowel cancer. So the Cologuard test is very good. And it's just as effective as the colonoscopies are, and a whole lot safer.
Is that the one that they give you at the hospital? And the little
Cologuard is the one that you can do from home. There's commercials all over TV about it now, but it's a test that it tests to see if there are basically DNA from cancer in the stool and in that blood that's coming from the stool. So that's the first thing to eliminate. If she's never had any type of test like that done, do the Cologuard.
Yeah, you don't need a prescription for that. You just go.
Yeah, you do.
You do? Oh.
Yeah, the doctor has to order it. But you're age 44. I don't see why you would need to have a colonoscopy. Let's do the Cologuard first. And if they see something in the Cologuard, then the next step might be a colonoscopy and checking for the polyps and all. But let's start with the Cologuard. It's less invasive, less dangerous.
Okay.
There
Dr.
you go.
Mike, go ahead.
Okay. Yeah, well, a good start. When somebody weighs 155 pounds, You need to get rid of all the bad foods. No fried foods, no processed meats, no oils, no glutens, no wheat, no brown rhinos, no sugar, no carbonated drinks. Even the diet one's got to go. And then 2 healthy brain and heart packs per month. 2 healthy brain and heart packs per month. Full dose of everything twice a day. For the high blood pressure, I'd have her use 2 bottles a month of the Ultimate Daily Classic tablets. Take 3 of those twice a day. That will support and promote healthy blood pressure and blood flow through blocked arteries. And then also, I want her to have 2 bottles a month of the MSM. So you can take 3 at breakfast, 3 at lunch, or dinner time. And they're going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between vertebrae, bone breaks, bone cell. Because at age 44, you're right at that age where the joints are starting to break down a little bit, little pain in the back, little ringing in the ears, dizziness, tingling and numbness in your toes and fingers and stuff. All the bone stuff starts happening in middle age between 35 and 50. And so this is a good time to jump on that, because people forget your bone marrow is your immune system. Mm-hmm. Your bone marrow produces red blood cells. Your bone marrow produces white blood cells to go kill and eat viruses, bacteria, fungus, and yeast. Your bone marrow also produces platelets to prevent you from bleeding to death. Your bone marrow, most people never get to see their bone marrow in their whole life. It is one of the most important tissues in their body. And so we got to take care of it. Okay.
Thank you.
We look forward to hearing from you every couple of weeks.
Yep, sure do. And look forward to hearing from you as far as the results of your tests. Also, believe it or not, back issues can cause constipation, because there are nerves that lead from your back, from your spinal cord to your digestive tract. So anytime a nerve leading to a specific part of the body is pinched, it can cause symptoms that would seem completely unrelated. So,
yeah, like getting up 10 times a night to urinate.
Yeah.
It's not a prostate gland, because women get the problem.
Right. You could have a bladder issue, or you could have a pinched nerve leading to the bladder. So that's why it takes some diagnosis on this. Ultimately, this is what I like. Again, I'm a healthcare professional, and I believe that there's, we need to look at all the different avenues that could possibly be causing an issue. But ultimately, if you trace it back far enough, a nutritional deficiency started the chain reaction that's causing your health issues today. It all goes back to our nutrition and absorbing the minerals and the nutrients, our being able to ingest the right amount of nutrients. Everything goes back to that. Trace it all the way back. That's where it starts. And that's why I'm so adamant about this. We've got to get the nutrition in there, because if we never address the nutrition issue, I don't care what prescription drugs you get. I don't care what doctor interventions you get, what surgeries you get, it's never going to fix the problem. You've got to address the underlying nutritional deficiencies before anything else is going to work. Modern medicine is miraculous at times, but it doesn't fix anything without you doing what you need to do.
You get an A+ Pharmacist Keith.
All right. Somebody, I understand part of their question. They want to know if you can sprinkle the unflavored collagen on food instead of mixing it in a drink. And absolutely you can. Believe it or not.
The collagen peptides has no flavor to it, no smell. It's just a kind of a white crystalline powder. Mm-hmm. And you could put it on applesauce. You could, put it on your salads, do all kinds of stuff with it.
I mean, I put it in my drink every day, but I've also been known to put the collagen peptides in some pudding when I make pudding for the kids. So they never know what's there. Okay, this comes up from time to time. Uterine fibroids and menopause issues. I don't have specifics about the patient, but if you can address those 2 issues, uterine fibroids and menopause.
Okay. All right. Well, when you have menopause, that means that the production of estrogen and progesterone are starting to go down. That's the thing that causes the process of menopause. You get a little older, all that stuff that was going on when you were young, your periods and your cycles and everything go away. Okay.
How to make it more comfortable.
I understand. And then fibroids, again, it has to do with lack of hormones. And so the muscles in the uterus can become more connective tissue and less muscle kind of stuff. It can be painful. Okay. And so let's say, what would you do about all of this? Well, in addition to your 90 essential nutrients, and again, when you get into that age where you're going to be going through menopause and you have fibroids and stuff, I'd go with a bigger hammer. I'd go with the Healthy Brain and Heart Pack, 1 per 100 pounds of body weight per month, divided up, obviously. And then also, I would add to that 3 eggs twice a day with soft yolks. So I have mine. I don't have fibroids, but I don't want to get male hormone problems, deficiency problems. So 95% of the weight of male hormones, testosterone, is cholesterol. 95% of the weight of female hormones, estrogen and progesterone, is cholesterol. So you need those eggs to make sure you're getting all the raw materials so that your body can make the hormone, the appropriate hormones. Then I also want her to have, the ladies to have our Xerafem. The ladies can have Xerafem, XERA-FEM. Go ahead and take 3 of those a day. 3 twice a day per 100 pounds of body weight. If they weigh 200 pounds, it'd be 3 twice a day. Okay. And the same way with men, they need the Xera test for men, XERA-TEST for men, for making more testosterone. But don't forget the eggs. Both the male and the female need to have the eggs for the cholesterol to make the hormones. And the 90, and of course the Xera test for females, Xerafem for females and Xera test for males. And all these problems go away. It should be a smooth transition. And in the old days, it wasn't a big deal where you had to go to the OBGYN and take 3 different drugs and do surgeries. And, humanity wouldn't have survived if we had to go through that, thousands of years ago. Well, once we change our diet, once we change our fuel source from wood to electricity, suddenly now we have all these problems because the basic stuff of life is being excluded from our daily living. So we have to consciously, proactively put them in there. Okay, back to you, Pharmacist Keith.
There's one product Dr. Wallach didn't mention that it's one of the older products from his company, and I have had excellent results with the ladies that I know that have gone through menopause, and it's called the Women's FX.
Mm-hmm.
Women's FX, it actually is a formulation. It's got the minerals in it, just like all of Dr. Wallach's products. So it's a good source of the minerals. But he's also added to that some herbal type medicines. These are phytonutrients. It's got black cohosh in it, and black cohosh has been used for centuries for menopause symptoms. It helps especially with the hot flash symptoms. Also, it has in it the wild yam and soy isoflavonoids. The soy isoflavonoids is a natural source of estrogen, and the wild yam extract helps balance the estrogen. So it's an excellent combination using old school herbal remedies to address the problem. And like I said, every lady I've ever given this product to has sworn by it. They all say it tastes terrible, but they order it continuously all the way through their menopause because it gives them so much relief. So
Women's FX.
Women's FX. And it's not a very expensive product. It comes in a quart bottle, basically an ounce per 100 pounds of body weight.
Very good.
Okay. Let's see, any more questions on Facebook. If you got a question on the Zoom side, go ahead and jump on while I read the Facebook comments. Okay.
Yeah.
Got someone. Go ahead.
I was just going to say, I just want to remind everybody that don't forget to make your hormones for male and female, you do need the cholesterol that's in the egg yolk. So don't forget the 3 eggs twice a day, soft yolks. Hard-boiled eggs won't count, and fried eggs are dangerous.
Right. I like to take my eggs and cook them in butter. You cook it at a low temperature. If your butter's starting to turn brown, you have the temperature up too high. That's how I cook my eggs. I mean, I'll fry an egg, but I fry it that away. I don't want that butter to get brown, and then it's okay. Okay, I've got someone that's recovering from we'll just say the man-made disease that we've all been going through. She's recovering from that now, finally tested negative after about a week. She's having a lot of mucus and cough issues, still feeling very weak. Her O2 levels are fine. Wants to get advice on the cough and mucus, and would killer biotic be of benefit?
Well, yeah, killer biotic could certainly be a benefit. It's a mushroom product to support the immune system. The main one is a reishi mushroom, which is legendary for supporting the immune system, but also persistent cough for a middle-aged person, woman or man, could be osteoporosis of the skull, squeezing the ninth cranial nerve, the glossopharyngeal nerve. Okay. Clearing the throat like that all the time, accumulating mucus, because, you know, we produce mucus from the time you're born in your throat. And unconsciously, you don't even know it, but you're swallowing that mucus constantly. Okay. Well, when you have osteoporosis of the skull, squeezing that ninth cranial nerve, that glossopharyngeal nerve doesn't want to work very well. And so that's why you start getting accumulations of mucus. You get a tablespoon of mucus back in there rattling around, and you're trying to cough and get rid of it, and so forth. And so that's why you have that little bit of pathology there. Okay, because the skull is squeezing the ninth cranial nerve. And usually they will have other symptoms. They can have back issues, they can have knee issues or shoulder issues, finger issues. They can have dental problems, receding gums, bleeding gums. They may have gone to an orthodontist when they're 12, 15 years old because their teeth are loose and wandering around. Just remember, your jaw is part of your skull. And babies are born with osteoporosis of the skull. It's not an aging thing. It's a simple nutritional deficiency disease. Babies are born with osteoporosis. They get what's called Erb's palsy, and doctors think it's cerebral palsy, which is a common birth defect. But also the let's see here, the palsy that kids get when they have osteoporosis of the skull, Erb's palsy, okay, is the skull squeezing that spinal cord when the baby's born. And so you can make it go away in a couple of weeks just by making sure that that newborn baby is getting all the 90 essential nutrients. In addition, if the mother's being breastfeeding the baby, she's got to be off of gluten so she can absorb the vitamins and minerals she's taking to, you know, to try and get these nutrients into the breast milk. But she cannot be eating oatmeal for breakfast and expecting all these nutrients to get into the breast milk. Okay, this is not complicated, but there's a lot of detail that has to be dealt with.
Right. And, you know, COVID has a lot of issues that are all related to the weakened immune system. So the key is getting that immune system up to power. And one of the products that I like best for boosting the immune system is the Z radical.
Mm-hmm.
It's very high in antioxidants. Another thing I'd recommend too is there's a product called eucalyptus and honey wintertime syrup. I've found that to be the best product that we have when you've got any type of, especially in the wintertime, when you got those lung issues and stuffed up head, it really helps loosen up that mucus in the chest so you can get it coughed out. It's eucalyptus and honey wintertime syrup. And also there's some products in the aromatherapy line. Unfortunately, I do not know a lot about aromatherapy. I would suggest you go over to the Longevity private group page and post on there what aromatherapies you would, folks would recommend for those symptoms. Because again, there's a lot going on with this disease, a lot of things we don't know about how it's affected different body parts. And the main thing is got to get the immune system boosted, but there are things that can help along the way. And aromatherapy, I think, is something that would be beneficial. Doc, I don't know if you have any answers on the aromatherapy side.
Yeah, well, we actually have a book. It's called A Passport to Aromatherapy, and goes into all the classic aromatherapy oils and what they're used for and so forth, what to expect from their utilization, the dosage and everything. It's kind of a companion book to go along with Let's Play Doctor. Okay, Let's Play Doctor, Let's Play Herbal Doctor, and Passport to Aromatherapy. Those three books, every family should have that set. Okay, and that covers a lot of territory. And if you don't have any experience with aromatherapy oils, that book, Passport to Aromatherapy, it really covers the whole category very deeply.
All right. And Margie, can you jump on? Because I'm not sure what your question is. Can you unmute yourself?
Can you hear me?
Hear you perfectly.
Oh, okay, great. So my friend Lily is on. She doesn't know how to ask a question, but she has high blood pressure, and she was wondering if it's the Ultimate Classic or the Ultimate Daily Classic. You have two products, and I'm not sure what it looks like. Does it have a green label and a white bottle?
Okay, yeah, it has a green label. It's a glass bottle. Okay, it's a green label and a glass bottle. Ultimate Daily Classic tablets. She wants to take 3 twice a day, and that will support healthy blood pressure and healthy blood flow. Ultimate Daily is a big yellow multiple. It was our first multiple we had 50 years ago. Okay, it's still very popular. When people have, a limited budget, they can get the Ultimate Daily and the EFAs. That covers a lot of territory, the Ultimate Daily and the EFAs. But when you have high blood pressure or obstructed arteries in the brain, coronary arteries in the heart and the kidneys, you got high blood pressure and all that kind of stuff, you want that Ultimate Daily Classic, not the Ultimate Daily, but the Ultimate Daily Classic. And these tablets are ones that, again, I only weigh 142, and I take 3 of those twice a day just to prevent high blood pressure and to make sure that blood is flowing into my brain and my eyes and my heart and my kidneys and, every place it's supposed to go. And so I do a lot of things for prevention as opposed to waiting till I get something and then try to find something to deal with it. And so, again, I'm 83 years old. Most people think I'm in my 50s when they look at me. I've never been on a prescription drug except for 3 days when I was on an antibiotic when I had an infection resulting from a puncture wound at a construction site some years ago. But other than those 3 days on an antibiotic prescription, I've never been on a prescription drug. And I'm 83 years old and I don't have any health problems. Isn't that amazing?
Absolutely. The only prescription drug I've ever known Dr. Wallach to take is just antibiotics. And that when he injured his foot, he had to be on a round of antibiotics. But, that's the only class of drugs that actually heal something. And unfortunately, we take in our society now, we've gotten so used to plop, plop, fizz, fizz, over the relief it is, take this to solve that people are over taking antibiotics. So I just wanted to briefly address that. If you go in because you think you've got the flu and you demand your doctor give you a Z-Pack, that's what the majority of people ask for, Dr. Wallach. They want that Z-Pack because they think it's going to cure that flu. It's going to cure that virus. Z-Pack's an antibiotic. It's a powerful antibiotic, but it doesn't do anything whatsoever for flu or a virus. It doesn't cure flus or viruses. It cures bacterial infections. So what you're doing when you're demanding the doctor give you that Z-Pack because it's going to make you feel better, you're making your body become immune to that. The bacteria that's in your body that normally would react to Z-Pack, the more you give it a taste of Z-Pack, the more the bacteria finds a way to get around that Z-Pack. And someday you're going to have an infection that's going to cause you to be in the hospital on a respirator because your body, the antibiotics aren't going to work for it anymore because you have slowly made your body be immune to it. So I just wanted to touch on that. Dr. Wallach, he's always saying he doesn't take prescription drugs. It's extremely rare that he has ever had to take an antibiotic in his life. We've talked about that before. He had to take an antibiotic when he had that foot injury, and that was to prevent an infection. And he did it smartly. But every time you get a stifling nose and a cough and all that, do not go to your doctor and demand an antibiotic. Go to your doctor and see if the doctor can figure out if it's a bacterial infection or a viral infection. And if it's a viral infection, you just got to wait it out. You got to support your immune system. You got to take that Z radical or the
Fucoid Z.
Killer biotic. And you've got to boost up your immune system, and that's going to cure that viral infection faster. Colloidal silver, absolutely. You get a cut on the hand that doesn't seem to want to heal, no matter how much triple antibiotic ointment you've put on it. It's time to break out the colloidal silver and put that on there. But my point here is I'm not trying to make a negative point about Dr. Wallach never having any medications because antibiotic is a medication he has taken, but we tend to overtake antibiotics in our society. The more antibiotics you take, the more digestive problems you're going to have in your life because it's killing off the good bacteria that's in your digestive tract because it does a good job at killing bacteria. And you don't want to kill off all those good bacteria in your gut. Kids that are constantly having to go in for ear infections and are constantly on antibiotics for that, they have all kinds of digestive problems later on. It's just something we've got to be aware of. Now, Dr. Wallach, I got another question here. I'll let Sherry jump on in a second to ask about this specific person because there's more to it than that. But this is a question that came up to me the other day from someone that has gout issues. And gout is, for those that don't know it, it's a buildup of uric acid in the joints, and it's extremely painful. And there are certain foods that can cause this, but I wanted Dr. Wallach to address gout and the causes if he can, and what you can do to prevent gout. And when you know a gout attack is coming on, what you can do.
Okay. Well, gout, as Pharmacist Keith said, is a combination arthritis with a secondary piece to it called uric acid. And uric acid is found in some beans, but it's also found in seafood. Okay, we're talking about shrimp, crab, oysters, clams, all those kind of things. You got to get all the seafood out of your life.
Yeah, the person I was talking to you about that, he eats a lot of seafood, and his doctor never told him to eliminate the seafood, just the beans.
Shame on that doctor.
Yep.
Yeah, and then they need to take one healthy brain and heart pack per 100 pounds of body weight. They need to get the MSM, one bottle per month per 100 pounds of body weight. And that's going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, discs between the vertebrae, bone, make bone cell. And so gouty arthritis will go away. As long as you stay away from the bad foods and take your 90 essential nutrients. Again, I'm 83 years old. I don't have any arthritis anywhere. I don't take any arthritis medication, prevention, symptom treatment. I don't. Okay. And it's because, I played sports. I played football. I only weighed 110 pounds. I played football. I wrestled at the University of Missouri and lettered wrestling at the University of Missouri and in high school and junior high and so forth. And spent a lot of time in the military and never got hurt. And all the guys around me were getting hurt all the time, but I never got hurt because I'm still taking all my essential factors when I was in the military. And everybody else, they go out for one day first of exercise. They were laid up for 2 weeks. That never happened to me. Okay. And I have all my own teeth except one, which was knocked out in a fight. 3 guys assaulted me in a.
That was when one of your talks you were given, wasn't it?
Well, it was on a weekend. I was out of town and I was shopping in a mall, is what it was. And I had 2 handfuls of bags full of product in there, and they were trying to take my stuff. And so I didn't know how aggressive they were until the one guy just punched me in the face and knocked out one tooth. And so I knocked out all of his teeth, and the other 2 guys just ran away. I kept my product, and the guy was just laying there on the ground when the cops came, and they took him to jail. And so that's how that works. But yeah, I only have one tooth missing. I'm 83 years old. All my teeth are perfectly normal. I don't have any plates or, I don't have any implants or anything like that. All my own teeth.
Okay. So, Sherry, if you can go ahead and ask about Siobhan's son.
She's here. Did you want to talk to him? Oh, okay. She's saying that he's male, 46, 290, 5'11". He smokes cigarettes, and he has high cholesterol and is taking statin medications.
And he has high blood pressure.
And high blood pressure.
And he's the one suffering from gout also.
Okay.
We answered part of the question.
Okay. Well, 290 pounds, 5'11". He's almost 100 pounds overweight. So he needs 1 meal a day, to add on to a meal. It's a meal replacer or a keto shake. Comes in strawberry or chocolate. And he can have 2 or 3 of our rebound drinks with that. It has 100 nutrients in it. And he'll lose a half a pound to 2 pounds a day. So realistically, he's looking to 3 or 4 months, he'll be down to 200 pounds where he needs to be. And then I really, really would like him to either significantly reduce his smoking or get rid of the smoking. And every time he craves a cigarette, he should take, a shot of our Z Radical. It's a detoxifier, but it has all these minerals from the ocean and seaweed and plankton and that sort of stuff. And so I like the Z Radical for helping people get off of smoking, whether it's cigarettes or cigars and things like that, even chewing tobacco. And then I want him to have 2 bottles. Well, let's go back further. 2 of the Healthy Brain and Heart Packs per month, a full dose of everything twice a day. 2 Healthy Brain and Heart Packs per month. And finances are not a problem. At 290, he could take 3 to begin with until he gets down to 200 pounds. But a minimum of 2 Healthy Brain and Heart Packs per month. And finances are not an issue. He could take 3, take a full dose of everything at breakfast, lunch, and dinner. A minimum, he needs a full dose of breakfast and dinner. And then for the high blood pressure, I'm going to get 2 bottles a month of the Ultimate Daily Classic tablets. So I can take 3 at breakfast, 3 at dinner time, and they will support and promote healthy blood pressure and healthy blood flow through blocked arteries. And then let's see here. For the smoking, again, every time he craves smoking, try that Z Radical. Take a couple of shots of that, and it'll satisfy him. And at the very least, he'll be able to cut the smoking down from, say, a pack of cigarettes a day to maybe 3 cigarettes a day. That's, we want to do what you can do and lose that weight. And it'll be one of those things where, and then he's got to get rid of that uric acid, no seafood, no seafood, no seafood. And there's certain beans that have uric acid in them. And so you have to stay away from those forever. And so and if you want,
we're talking about things like kidney beans and that type of bean.
Yep. And you can also use our CM cream topically on your joints for pain relief. We also have Soothe from our Hemp FX division. Soothe has the stuff from marijuana in it, but it has no THC. It's just a CBD oil. Yeah. And it'll give you about 4 hours of pain relief, whereas CM cream will give you 2 to 3 hours of pain relief. So I like people, if they really have serious problems with joints, I say, okay, take the CM cream every couple of hours during the day, and then a half hour before bedtime, use the Soothe from our Hemp FX, and it'll give you 4 to 6 hours of good pain-free sleep that night.
And if you want to boost the CM cream, add a few drops of trauma oil to it.
Well, there you go.
That will boost it. One more thing I'd like to add on the smoking cessation side of it. Now I'm putting my pharmacist hat on here, but I would recommend the Hemp FX Uplift. They found some benefit to some of these serotonin type drug products when it comes to smoking cessation. And the Hemp FX Uplift has, in addition to the THC-free cannabinoids that come from hemp, it also has St. John's wort, which is a natural herb that's been used for centuries for mood disorders. And those type of products have been found to be beneficial as a smoking cessation product. You're not going to see an immediate effect. Just like the prescription drugs, it's going to take probably a month taking it every day before you start seeing benefits from it. But it will reduce the psychological side of the need for smoking, the depression and that type thing. It will help with that side of it. And it's a very good alternative to the pharmaceuticals, and it's a safe, natural alternative. So check with your pharmacist with your other prescriptions that you're on to make sure that there's no interaction with the St. John's wort. But other than that, that's a very good smoking cessation to add to the program.
Okay. Well, I think we've hit
the top of the hour.
Yeah. Well, thank you so much, Pharmacist Keith.
You're on twice a day. Tell us how folks can reach you, unless you don't have time for that.
No, I have time for that.
Okay.
Okay. Monday through Friday, I'm on noon Pacific time to 1 o'clock. That's what Dead Doctors Don't Lie. And you can get me through 1-888-379-2552. Again, that's 1-888-379-2552. And that's toll free. And then from 1 to 2 Pacific time. I'm on Let's Play Doctor, okay, with the Lamar Radio Network. The number is 1-877-912-PLAY. That's toll free, 1-877-912-7529. And again, both of those are toll free, so you can call in. And even if you have to sit on the line for 15 minutes, I'm paying the bill, so don't worry about it. Mm-hmm. But we get calls from 80 different countries on that show. So you'll get a lot of information just by listening in sometimes, as opposed to even asking questions. And if you want to, really, really build a large longevity business of your own, it's good to be listening to this stuff so you know where to go when people ask certain questions about certain health issues. Thank you so much, Pharmacist Keith, for a fabulous, fabulous event like you always put on. Thank you so much. And I can't wait until we get our 10 CDs out there. It's going to be a great, great tool.
I think today's call went well. We'll be reposting it on the usual places. It'll be on the Ask Pharmacist Keith podcast on your favorite podcast platform. A lot of our past shows are there. Dead Doctors Don't Lie Radio. You can hear an archive or visit an archive of past shows on there. So if there's specific things you want to look for, they're on radio.givedoc90days.com. And that goes back several years. I mean, it goes back many years on that archive. And that's the Dead Doctors Don't Lie show, weekdays 3 to 4 p.m. Eastern, 888-379-2552, 888-379-2552, radio.givedoc90days.com. That's 90. radio.givedoc90days.com. Also, Let's Play Doctor, weekdays 4 to 5 p.m. Eastern, 877-912-7529. Also encourage you to go to Dr. Wallach's website, drjwallach.com. That stands for Dr. J. Wallach, drjwallach.com. You can get all your books, CDs, DVDs, even a few cassettes are still hanging around. There might even be a old VHS tape hanging around somewhere in his
there's a few
in his closet. So all that's available there. I encourage you to go and buy directly from Dr. Wallach. His sole income comes from the sale of these books and CDs and DVDs. You can find some of them on Amazon, of course, but I encourage you to go directly to his website to buy them. Price is the same, whether you buy it on Amazon or buy it directly from Dr. Wallach. The only difference is when you buy from Amazon, you're paying Amazon a commission for the sale of these products. Why not give all that money directly to Dr. Wallach and show your appreciation for him by buying direct from his website, drjwallach.com, drjwallach.com. He'll even give you a discount for volume purchases, something Amazon will not do. So drjwallach.com, right, Dr. Wallach?
That's right. You buy 10 books of the same title, you get a big, big discount.
Absolutely. And again, I thank you very much for tuning in every week. And Dr. Wallach, we will see you next week. I'm sure I'll talk to you in the meantime.
Oh, absolutely. God bless you. Thanks for all the great work you do. You're an angel of God, and we love you and appreciate you. God bless you, sir.
All right. Thank you very much. All right, folks, if you go over to dddlvideo.com, it's on the screen there, dddlvideo.com. You can get 2 free gifts. You can get a report that you can download to your computer called Why So Many Young Athletes Die. You can download that to your computer, put your contact information on there, print that sucker out, and give it out to all your friends and family. Absolutely no cost. It's free for you to use. Also, there is a link to a video in the Dead Doctors Don't Lie series called Someone Should Go to Jail, Health, Lies, and Medicine. It's a link that you can share with folks. Again, all this is free to you. Free for you to use this, to share it. I do not collect any information. I have no idea who visits this website. No email spam coming to you, no text message spam coming to you when you visit. It's just totally free to you for tuning into this program every week. And that's dddlvideo.com. And one last thing, we do have a swag shop where we have some of the products that, t-shirts and bags and so forth to help support the program. That's at swag.campaignfornutrition.com. There's a t-shirt there with Dr. Wallach's face on it and one of his quotes on that t-shirt. I'm trying to get the link to pop up, but it's acting up on me here. But there's some t-shirts, some sports bags that you can use to carry your samples in, and with different sayings from Dr. Wallach, and that's at swag. Here we go. Finally got it to come up. There we go. There's a picture of the bag. The greatest medicine is to teach people how not to need it. If you're a certified holistic health coach, that's a great product to use, put your samples in. And there's a t-shirt that matches that without the certified holistic health coach at the bottom. It's just the saying in Dr. Wallach's picture. But anyway, your swag is there, swag.campaignfornutrition.com. And I think that's it for today. I'm going to go ahead and jump off here. I'm not going to play the video that I usually play at the end. Just give folks a break. I've got my grandson downstairs waiting for me, so I'm going to go down there and enjoy him. If you need to get hold of me, you can visit askpharmacistkeith.com. You can send an email to askpharmacistkeith@live.com, or you can text me at 502-212-2929. That's 502-212-2929. And we will see you again next week, same time, same channel.
Thanks for tuning in to the Health and Wellness Hour with Dr. Joe Wallach and Pharmacist Keith Abell. If you found value in this episode, be sure to like and share. Also, to be notified when the next episode is posted, click on the subscribe button, then hit that little bell symbol. If you have any questions or comments for Pharmacist Keith or Dr. Wallach, you may send a private email to askpharmacistkeith@live.com, or by visiting the Facebook page, Give Doc 90 Days to Better Health, Wellness, and Longevity. To hear more from Dr. Wallach, he has 2 nationally syndicated radio programs daily, Dead Doctors Don't Lie and Let's Play Doctor. Check your local radio listings for details. Also, check out the archives of his past shows at radio.givedoc90days.com. One last thing, if you'd like to join Dr. Wallach's crusade to share his message with others, contact Pharmacist Keith, and he'll teach you how to share the message and create some extra income at the same time. Contact Pharmacist Keith through his email address, keith@prosperityrx.com, or call or text at 502-212-2929. Remember, Keith is still a practicing pharmacist and can't always pick up the phone right away, so leave your name, number, and best time to call, and he'll return your call as soon as possible. Thanks again for tuning in.